So today we are going to talk about Huntington's disease, Lyme disease, and stress, and how each of them affect the brain. Three very interesting topics today. Here's our objectives for those of you who do need your CEUs. So let's start with Huntington's disease, because again, we've got a lot to cover with these three very different diseases, and I've got a short video for each one that we're going to look at. So Huntington's disease sometimes is also called Huntington's chorea. The chorea is the Latin word for dance, and the reason that it is called that is because it's the type of movements that they start to make. And I found a video where you're actually going to get an idea of the kind of movements that the body starts to make that they have no control over, somebody who has Huntington's. It is rare in your career. You may, if you're a social worker, nurse, you may come across this a couple of times in your career. I've had one resident with it so far, so fewer than 200,000 cases per year in the United States. It is genetic, it's inherited, and it really has a wide range of impact on a person's functional abilities. When you study it, it's fascinating to study what it does to a person's brain because of what it does to their thinking and their psychiatric issues, as well as their movement disorders that they develop. And then it is a long disease that takes place over the course of 10 to 30 years. It also is a disease where the person starts having symptoms very early, and it is fatal, where they will start having symptoms in their 30s, 40s, 50s. Sometimes it can start in their 20s, and when it does, that's called Juvenile Huntington's disease. The younger they are when they start having the symptoms, the faster the disease moves, just like with the dementias. Huntington's does fall under the dementia umbrella. Let me move this just a minute so I can see better. This is a graphic here that kind of gives you an idea of what happens. And this is a mutation that happens in a gene. So the breakdown, and again, you're going to get these slides. With the exception of genes on the sex chromosomes, a person inherits 2 copies of every gene, 1 copy from each parent. A parent with a defective gene could pass along the defective copy of the gene or the healthy copy. So each child in a family, therefore, has a 50-50 chance of inheriting the gene that causes the genetic disorder. So in the video that we're going to watch in just a minute, if I remember right, the dad had Huntington's, the mom did not, and all 3 of his children ended up with it. There's 50-50 chance, but all 3 of the kids ended up with it. The family that I knew, the father had it. There was a daughter and a son. The daughter had it, the son did not. If you'll also notice there, a child who does not inherit the Huntington's disease gene will not develop the disease and generally cannot pass it to other generations. But the person who inherits the Huntington's disease gene will eventually develop the disease. It is usually diagnosed with the genetic test, medical history, brain imaging, and then neurological and laboratory testing as well. And this is what it looks like in the brain. And you can see it's very obvious. When we've talked about dementia before, we've talked about brain atrophy, and you can see atrophy here as well. The normal brain is the one on the right. The one with Huntington's disease is the one on the left. You can see the brain atrophy. You can also see the changes in and around the hippocampus, which is where memories are. This is why it does eventually fall under the dementia umbrella. In the beginning of the disease, it does not, but this is one of those diseases that it does not present with memory loss, but as it progresses, the memory loss comes later. I've got another graphic here that shows changes. The normal on the left, Huntington's disease is on the right to show the enlarged ventricles. And then I found this that gives you a little bit of an idea of what that chorea is. And I was explaining earlier that that word chorea is Latin for dance. It's kind of a involuntary jerking or a writhing movement. It's hard to get it in a graphic. It is a muscle problem. The muscles start to have contractures, and they'll kind of move back and forth slowly. There can be a little bit faster movement, but they'll move back and forth slowly and not realize that they are doing it. They may also have some slow or some abnormal eye movements and impaired gait, so they become a very high fall risk. Abnormal body posture, as you kind of see there in that graphic, and balance. Lots of difficulty with speech and swallowing. But while this is taking place, they do not realize that it is taking place. Even though their body may be moving back and forth in really big movements, to the point that I had a woman, she was in my office and knocking things off of my desk. She was not realizing that she was knocking the things off of my desk. She thought they were just falling off of my desk. So this is part, and we're going to kind of break down the symptoms. This is part of the cognitive disorders that comes with Huntington's. Having a very hard time staying on task, almost like an ADD or like an attention deficit disorder, with the tasks that you may want them to stay on task with, because there's going to be another side to this where they can become obsessive compulsive with specific tasks, but it's the task that they want to stay on task with. They can get very obsessed. And that's very common with Huntington's, for them to have some obsessive compulsive behaviors. But we may be trying to get them to eat, or to get dressed, or to brush their teeth, or do some of those activities of daily living, and they have a very hard time focusing on a task. But then that second one, lack of flexibility or the tendency to get stuck on a behavior or an action. So for example, the one resident that I have experience with, when she would make up her mind about something, and one of her things that she had to do, needed to do, was before she could go to bed, she had to cover the floor with paper towels. The entire floor had to be covered with paper towels. That is not harming anything. So there is no reason why she shouldn't do that. She can cover the floor with paper towels, that's fine. But she had to do it, and she had to do it right now. And when she decided it was time to do it, we had to do it right now. We weren't going to do anything else until we did that. And so we just had to understand that we weren't going to take medicine. We weren't going to change clothes. We weren't going to do anything else until the floor was covered with paper towels. We need to make sure we had enough paper towels. That lack of impulse control, which could result in outburst. They could act out. They could even have some sexual promiscuity. Lack of awareness of their behaviors or their abilities or their body movements. And then slowness in processing their thoughts or finding their words, and then having real difficulty in learning new information. And then this also has some disorders that fall under psychiatric disorders. And depression is part of that. A lot of irritability, sadness, apathy, social withdrawal, early with on, you see a lot of this. Insomnia, not being able to sleep, fatigue, thoughts of dying, and will express that, saying things about suicide, saying things about other people dying, not necessarily killing them, but compulsive thoughts about death. That obsessive compulsive disorder there, that shows up again. And that can be with all kinds of things, whether it's something like covering the floor in paper towels, to looping is what we call it, whenever somebody can't get a thought out of their mind. And where with other dementias, where we can redirect fairly easily, somebody with Huntington's, it is very, very hard to redirect. Once that loop gets started, very difficult to redirect. They can have mania, they can develop a bipolar disorder and lots of weight loss, especially near the end of the disease. This chart shows the early, middle, and late stage of Huntington's. It progresses a little bit differently than our dementias that we typically talk about. We always make sure for getting a diagnosis, getting a family and medical history, neurological exams and testing, psychiatric evaluations and brain imaging, genetic testing. And then again, it's broken down here into early, middle, and late. And you can see that early, it just kind of starts with clumsiness. They may be falling, their gait may change, and then that chorea starts and is very mild. And then toward the late stage, it becomes severe. Eventually, they will not be able to walk. Another thing that is predominant in this is personality changes. Personality changes very, very early. Because this is in families, and families have dealt with it for generations, many times they are expecting it, but personality changes can be surprising because they don't know what to expect. We don't know what's going to happen. And another thing that can happen with the obsessive compulsive is hoarding. Hoarding is very common in people who have Huntington's disease in the early to mid stages. They do not want to get rid of anything, and it can be hoarding, the type of hoarding that you may have seen like on TV, that type of hoarding to the point that we can't get the front door open kind of hoarding. There is no treatment. The only treatment that there is symptom treatment like we have for other dementias. There are medications to manage some of the symptoms, but they can't prevent the physical, the mental, the behavioral decline. There are some medications that help with that chorea, but there's none that can prevent it. There's also some antipsychotics that can help with those outbursts, especially the ones that can be pretty violent and the hallucinations. The medications for the depression and anxiety actually do really well. Psychotherapy, so seeing a counselor, a therapist in the early to mid stages tends to really help and do well. And then physical therapy, occupational therapy, and speech therapy throughout the course of the disease are beneficial, and most definitely planning ahead. The next thing we're going to do is we are going to look at a short video of a sister who is taking care of her brother who has Huntington's disease. I want you to be able to see some of what the movements become. And this sister also has been diagnosed. So she is very, very, very early. She's not having any symptoms yet, but she knows it's coming. I believe they've already lost a brother. And then this is a brother that she's taking care of. She'll tell a little bit more about their story. But I want you, especially if you've never seen Huntington's, to see what happens with the speech and what happens with the movements. Jamie, if you'll just tell me if you can hear this.
Are you ready to come eat lunch? You see him laughing because he's scared my mom. So you want to put your chair down, or do you want me to do it? They call it a monster disease. So are you ready to go out to the kitchen and eat? It's like having Alzheimer's, Parkinson's, and ALS all together because you have symptoms of all three of those diseases. 1, 2, 3. At this point, it's considered a terminal illness because they do not have a cure for it. Eventually, your muscles give away and you can't swallow or walk or feel yourself. You get incontinent and stuff like that. My dad got diagnosed when I was 6. They just drugged him up because they didn't know much about the disease yet. I just know that it was a struggle growing up. she passed away 4 years ago from the same thing. He likes soups and stuff, so we do a lot of soup. My brother Mike, we noticed 20 years ago when my dad died that he was starting the symptoms. So between me and my mom for the last year, we've been taking care of him. No, go to the chair. We're gonna eat at the table. I have to make his meals. I have to help him get dressed. He stumbles a lot, so whenever he's up, I'm right behind him. Keep going. Okay, go ahead, sit. We've decided as a family and him that he wants to be here with me. And as long as I can physically do it, this is where he's going to stay and take the best care I can. Do you want half of this or do you want the whole thing? No, this. Half or whole? Half. Myself, I found out in 2006 that I had the gene. I mean, it changed my whole outlook on life. Like, I'm the most negative Nancy there is. I'm trying to get better about it, you know, but it's kind of hard when, especially when you're handed a paper, you know, and that says, you know, you have a terminal illness and you just gotta ride it out and hope for the best. It is progressing, and this is right at that age 46, you know, between 40 and 50 is when your symptoms really start to rear their ugly heads. Remember, drink some of your water too, not just. You're full? I figured. It's still a work in progress with my brain, you know, because I don't know if I'm getting the placebo or the drug, but I'm trying really, really hard to change my outlook towards it because, you know, whether I'm on the drug or not, at the end of it, I'm going to get the drug. 1, 2, 3. Good job. Fist bump. Fist bump me. Thank you. Look, this is what I have. You know, I'm going to fight it for as much as I can. And, you know, eventually there's going to be a cure. Keep going a little bit more. If not a cure, an active treatment to increase my quality of life by like 20 years. Because if I'm in the beginning stages of it now, my quality of life with stress and stuff will go down fast. And then I would be like my brother and my other sister. And I don't want that. On your side. Are you comfortable? Yeah. Okay.
So you heard her, whoa. So you heard her say, it's like ALS, Parkinson's, and Alzheimer's all together. And a couple of other things you may have noticed, his tongue coming out of his mouth. That's another one of those. It is like having no control over face, getting tics in the face, eyes opening and closing. We mentioned that. He didn't have the chorea near as bad as some people do. And you notice how she gave him choices. That's one of the things that we talk about with all dementias, where she asked him, do you want half or whole? You can tell she's done this before, where they did it with their dad. They did it with the sister. She's doing it with her brother, and she has already been diagnosed. You may have also noticed he had a different type of utensil. Those are called weighted utensils. And what they are is they're adaptive utensils. And weighted utensils are great for people who have tremors. So for people who even have Parkinson's, some people who have Alzheimer's or other different types of dementias, they're just a utensil that's made specifically. They're weighted, they're a little bit heavier, so they're easier to eat with. And then she had him eating out of the plate that had the 3 different compartments in it, so it was easier for him. And those are just different type of things that you can look for, and they're just adaptive utensils. They're just like there's adaptive clothing. There's all kinds of things that are out there that you don't know until you start looking for it. But Huntington's is one of those. And like she said, she's in a clinical trial. She doesn't know if she's getting the placebo or if she's getting the drug, but she knows it's coming. So this does give her time to make her decisions. Like she was saying, she doesn't want to get like her brother. She doesn't want to get like her sister. So she has time to make some decisions. All right, let's go to the next one. This is Lyme disease. Lyme disease, transmitted by the bite of an infected black-legged tick, commonly known as the deer tick. And that is a deer tick right there. I looked until I found the picture of a deer tick, and that's it. They are tiny. That's why I chose this picture, because that's on the end of somebody's finger. They have to be, that tick has to be infected with this specific bacteria that I'll not attempt to pronounce. And it can lead to Alzheimer's disease. It is very rare, and it happens in less than 2% of all cases. You're more likely to get Lyme disease if you live or spend time in grassy and heavily wooded areas where ticks thrive, of course. So it is just important to take common sense and common precautions in tick-infested areas. This is a scan of a brain of somebody who has Lyme disease. Somebody who has Lyme disease can have dementia-like symptoms. So they can have progressive cognitive decline, loss of weight, a gait disturbance. They can develop a tremor. And they can have a rapid recovery. They can get in, and it's been called Lyme-induced dementia. So this is one of those that if they can get in and they can get diagnosed, that this can be reversed. So unlike other dementias, patients have a rapid decline. This is also a way that we know that this is not Alzheimer's disease, because Alzheimer's does not have a rapid decline. It's progressive. So a rapid decline, and then an MRI scan that you can see there. And then this is what Lyme disease looks like. You'll look at the pictures there, 1 through 4, and everything that I read, they call it, by the time it gets to about 3, that it looks like a target. And we'll see more about this. And this is over the course, these pictures were taken over the course of 2 weeks. So there's another one. It starts out about the size of a mosquito bite. And it can be where the tick was, or where the tick was removed. And it may resolve over the course of a few days. However, symptoms can occur within a month of the tick bite. And it starts with a rash. That rash can show up anywhere between 3 and 30 days after the tick bite. A bullseye is what it's called, a bullseye pattern. And that bullseye pattern can get to be up to 12 inches across. It's not usually itchy or painful, but it can be very, very warm. And then the person can develop fever, chills, fatigue, body aches, headache, neck stiffness, and swollen lymph nodes. So if it is left untreated, some other things that can happen is a rash can spread all over the body. It can turn to joint pain and swelling, especially in the knees. And then the person can develop Bell's palsy, which is what the graphic is there. Bell's palsy is numbness and weakness on one side of the face, loss of movement in the forehead and the brow, like a droop of the eye. You can also have inflammation of the membranes surrounding the brain, which is meningitis, and then muscle movements. And I've got a short video on signs and symptoms of Lyme disease.
Lyme disease affects the patient in many different ways. It depends on which stage of the disease we're looking at. In the the first stage, the early stage, that occurs about 7 to 10 days after a tick bite, Lyme disease affects the skin where the tick bit the person. The skin is infected with the bacteria, and it causes a round or oval red skin lesion called erythema migrans. And that may or may not be associated with flu-like symptoms like feeling flu-like, achy, chills, sweats, fatigue, malaise. And that combination of the skin lesion and those flu-like symptoms are the primary manifestations of the first stage of Lyme disease. If you don't treat the first stage of Lyme disease, then in many patients, probably more than half, the bacteria leaves the skin where it was initially inoculated and goes through the bloodstream to other areas of the body. And then the manifestations change because now other areas of the body are infected, primarily the nervous system, the joints, and the heart. And so those manifestations are different. If it affects the nervous system, it may cause what's called a Bell's palsy or a drooping face. It can cause meningitis with headache and stiff neck, and it can cause heart problems if the bacteria goes to the heart. Those heart problems are usually a slow heart rate that may cause the person to pass out or feel like they're going to pass out. The symptoms of second stage Lyme disease are probably often the most difficult to ascertain. They are symptoms such as fatigue, generalized achiness of the muscles and joints, and sometimes patients also know what they call brain fog type cognitive symptoms, where they have trouble with short-term memory and trouble multitasking. These symptoms, though, again, are not specific for Lyme disease, and sometimes can make the diagnosis of second stage Lyme disease very difficult. Now, if we have objective signs such as facial palsy or heart abnormalities or meningitis, then we can more easily make the diagnosis of second stage Lyme disease. But in the absence of those outward manifestations of disease, relying on the symptoms alone is often problematic. Physicians may not think of second stage Lyme disease in somebody who has a fatigue or generalized achiness. And so you really have to think about it and then order the appropriate testing to make that diagnosis. The third stage doesn't occur for months or even years later, and that stage is called late Lyme arthritis. That's where a joint, usually a knee joint, swells up and has fluid accumulation and pain. And that's actually the way the disease was discovered in Lyme, Connecticut. It was an outbreak of joint arthritis in young children. So the symptoms vary a lot depending on what stage we're talking about.
Neurological issues from a tick bite. Who in the world would thought? That's also a great trivia question that now you know, where did the name for Lyme disease come from? From Lyme, Connecticut, where it was discovered, Lyme, Connecticut. So we want to spend the majority of our time today on stress and how stress, because Huntington's and Lyme disease are pretty rare. Stress is not rare at all. And in the past year and a half, we've had more of it than probably any of us have ever had in our entire lives. So stress is just anything that our body sees as a challenge or a threat to our well-being. So what is a stress to me and what is a stress to Jamie and what is a stress to you may be different things. But then there are things that are a stress to each of us. So right now, we have all been through a very stressful last 18 months because nobody can say that we haven't had a stressful time. Some may have come through it better than others just because of the way that we handle stress, but everybody, we are in a collective state of stress. We're in a collective state of grief right now. So, but let's look at how our body responded mentally, emotionally, physically, and behaviorally to these changes that have happened. Another thing that's interesting is that about 75 to 90% of all doctor's office visits are actually related to stress in one way or another. And again, you're going to get these slides, so you'll be able to see these better when you get these slides. But this is what stress does to our body, and we're going to break them down. But I just thought this slide really was able to capture it's our entire body. And then I was thinking back over the past year and the different things. Just think back through the people that you know and what has happened to them. And could we maybe go and put our finger on, could that be stress related? So we're going to break some of these down a little bit more. Especially notice this up here with stress and our head, issues with mood, anger, depression, irritability, sadness, lack of energy, sleeping issues, headache, pain, mental health issues. We're trying to get away from using that word mental health. We're trying to start using the word brain health. Doesn't that sound better? Brain health instead of mental health. We don't have a problem talking about our heart health, but when we call it mental health, people tend to shy away from it. But if we call it brain health, that doesn't sound bad. Stress, we can have skin problems. Our joints and muscles can ache because of stress. We most definitely can have cardiac issues, stomach problems. So many times our caregivers don't realize that the stomach problems they're having are a direct result of stress. Many people who are caregivers of those with dementia get diagnosed with IBS, irritable bowel syndrome. Whenever we are under a tremendous amount of stress and our brain is dumping cortisol and adrenaline, it stops our digestive system, which will lead to bouts of diarrhea and constipation over and over and over and over again, which can also lead to weight fluctuations. The pancreas is on there, intestines, reproductive system, and immune system. So listed those again and just kind of broke them down. Physical effects. So all of these things that you see listed here in physical effects, these can all lead to chronic illness. And they can lead to disease if they're not taken care of because of stress. When we're not, that very first one, when we're not getting enough sleep or we're not getting quality sleep, that can then lead to high blood pressure. High blood pressure can then lead to, and it can just snowball because of stress. And then look at this last one, decreased immune system. So there's an awful lot of research right now. There is papers being written about COVID. Why are some people, when they get it, they're having these symptoms. When they get it, they're having the, why are some people ended up in the hospital? Some people are barely having any symptoms. Is it something to do with the immune system? Some people have a decreased immune system when we're under a tremendous amount of stress. Here's those mental cognitive effects of stress. When we're a caregiver, we can even start to believe that we've developed dementia ourselves. We can get a brain fog. And many people, I believe, have been walking around this past year and a half kind of in a brain fog. Those of us who work in healthcare have been working on autopilot for about the last 18 months, because that's just kind of been where we are. But we can develop forgetfulness and start having some memory impairment just because of stress, decreased concentration, confusion. We can become accident prone. We can't focus. We catch ourselves having to write an awful lot of sticky notes. I'm guilty. Here they sit right here. Emotionally, stress can literally burn us out. It can hide behind feelings of hopelessness, anxiety, depression. It can even show up as paranoia, delusions, and suicidal thoughts. Many times, a lot of what we're feeling if we're a caregiver is grief, but we don't call it that because we tend to think that grief has to do with death. Grief has to do with loss. Whether you're a caregiver or not, everybody has suffered a tremendous amount of loss in the past year. You may not have called it that yet, but if you'll be really honest about it, we all have, and we're all grieving the loss of what was our normal. And we're in something called anticipatory grief about what will be, because we don't know, we're not there yet, we're still in the messy middle. So this question here says, are the emotional effects from stress grief or both? Is this grief? Is this stress? Is this, because grief has a lot of these same symptoms. We can work on stress. We can work on grief. We've got to call it what it is. To be able to get on top of anything, we've got to call it what it is. So here's some behavioral effects that stress can have on us. And notice whenever I was typing these up, it's almost like they're on opposite ends of the spectrum with a lot of them. We can completely withdraw and stop talking. We can become overly talkative. We can stop eating. We can start eating everything that we see. We can stop engaging in any activity. We can almost become hyperactive. Self-medicating. We've seen an awful lot of that in the past year. Numbers have gone up. Alcohol have gone up. Antidepressants, anti-anxiety meds are up. This then leads over to relationship problems. Of course, it's going to feed over into relationship problems. And what happens with stress is that our body starts to respond to something that we are perceiving as dangerous. We've been on high alert. We are, I think, still on high alert because we are hyper-vigilant right now, I think, as a nation. We've got those phones real close because at any moment we might get a news flash that what has happened next. And it's like we're on edge. What's going to happen next? Because we never thought what just happened could have happened. So what's going to happen next? And I think the majority of us are still walking around kind of on edge. So stress produces that hormone that I mentioned earlier, cortisol. And cortisol is linked to memory problems. But it's also linked to depression and anxiety. So in therapy, when we're talking about depression and anxiety, depression many times is kind of when we're getting hung up on our past. We're kind of sitting there in our past. Anxiety is when we are doing a lot of thinking about the future. What we're finding now, though, are these links between depression and dementia. Alzheimer's Society has found a link between PTSD, long-term stress, and dementia. And the reason that these changes are happening is because when we live for long periods of time, and we've got that cortisol and we've got that adrenaline, and we've got too much of it, it's changing the brain chemistry. and it's changing it permanently. And then people are ending up with dementia. In a long-term study that was done in Denmark, it was found that 1 out of 5 people who had decades of stress later developed dementia. So this is something they've been studying for a very long time, that stress is then related to dementia. So we're going to look at some prevention. We're going to look at some things that we can do. And we've got an entire series that we do on healthy brain aging, and you can look up healthy brain aging. And most of it's things that you know, but are you doing it? Making sure that you're eating healthy foods, we're getting productive sleep, that we're doing exercise. We know to do it, but are we doing it now? Not later, now. So again, this is just some more of the research that has found that chronic stress, prolonged and constant feelings of stress, has long-term changes on the brain. Also, that chronic stress playing a role in the development of depression and other emotional disorders. And there was some new articles that came out just earlier this year linking people who had had lifelong depression with later developing dementia. How stress changes the brain structure. This is another study on PTSD and chronic stress and what it does to the white matter and the gray matter in the brain. That gray matter are the neurons and cells that are responsible for the higher order thinking, such as decision making and problem solving. And then the white matter communicates information from one region of the brain to another. Now, there is good stress. We know that not all stress is bad. And that second to the last bullet point there, there's a psychologist who suggests that only bad stress impacts the brain in this way, in the negative way. Good stress, the type that helps us perform well in the face of a challenge, helps in a positive way, and it actually helps us build resilience. And that's a good thing. We want to build resilience. So it's not that all stress is bad, it's the chronic stress that we're talking about. So our brain is going to become one of two things. It's either going to become very vulnerable or it's going to become very resilient based on that pattern of white matter and how we are reacting or responding. So this is another study that was done. A single 20-minute stressful situation killed neurons in the hippocampus. They concluded that stress didn't impact the ability to create new neurons. It impacted the ability of those new neurons to survive. Okay, listen to that. A single 20-minute stressful situation killed neurons in the hippocampus. Okay, how many of those have you had? How many single 20-minute stressful situations have you had? And then this one also. Dr. Peterson has concluded that antidepressants may help keep the vulnerable new neurons alive. So many times when I am talking to caregivers, doesn't even have to be caregivers, people will be hesitant to get on an antidepressant. Okay, this research right here is saying that antidepressants may help keep those vulnerable new neurons alive. We've got another program that we do about depression and dementia. It has some very similar research that says that those who have treated their depression with antidepressants are less likely to develop dementia than those who don't treat their depression. So there's really some information there and something to think about. So some things to weigh. Antidepressants are something that can be used with therapy, and there's lots of ways to treat depression. That's the good thing about depression, is depression can be treated. Because even minor stress can affect our memory. Minor stress like that temporary panic that we get in the morning when we're running out and we can't find our keys. That's stress. We dump adrenaline. We dump cortisol right then. And that can contribute to short-term memory loss. The timing of stress comes into play as well, because memory can be enhanced by stress. Memory retrieval is often impeded in those who undergo tremendous stress as a child and they become repressed memories. Because if you think about something that's happened, maybe a car accident, all of us have had something that happened in our life, and as we think back on it, we remember it in slow motion. That's where that timing of stress comes into play. Memory can be enhanced by stress, where we actually remember every single detail. We can smell it, we can hear it, we can see it. Our sensory memories kick in, and it may have been a really stressful situation that took place. Okay, this is a short video we're going to watch on how chronic stress affects the brain.
Are you sleeping restlessly, feeling irritable or moody, forgetting little things, and feeling overwhelmed and isolated? Don't worry, we've all been there. You're probably just stressed out. Stress isn't always a bad thing. It can be handy for a burst of extra energy and focus, like when you're playing a competitive sport or have to speak in public. But when it's continuous, the kind most of us face day in and day out, it actually begins to change your brain. Chronic stress, like being overworked or having arguments at home, can affect brain size, its structure, and how it functions, right down to the level of your genes. Stress begins with something called the hypothalamus pituitary adrenal axis, a series of interactions between endocrine glands in the brain and on the kidney, which controls your body's reaction to stress. When your brain detects a stressful situation, your HPA axis is instantly activated and releases a hormone called cortisol, which primes your body for instant action. But high levels of cortisol over long periods of time wreak havoc on your brain. For example, chronic stress increases the activity level and number of neural connections in the amygdala, your brain's fear center. And as levels of cortisol rise, electric signals in your hippocampus, the part of the brain associated with learning, memories, and stress control, deteriorate. The hippocampus also inhibits the activity of the HPA axis, so when it weakens, so does your ability to control your stress. That's not all though. Cortisol can literally cause your brain to shrink in size. Too much of it results in the loss of synaptic connections between neurons and the shrinking of your prefrontal cortex, the part of your brain that regulates behaviors like concentration, decision-making, judgment, and social interaction. It also leads to fewer new brain cells being made in the hippocampus. This means chronic stress might make it harder for you to learn and remember things, and also set the stage for more serious mental problems like depression and eventually Alzheimer's disease. The effects of stress may filter right down to your brain's DNA. An experiment showed that the amount of nurturing a mother rat provides its newborn baby plays a part in determining how that baby responds to stress later in life. The pups of nurturing moms turned out less sensitive to stress because their brains developed more cortisol receptors, which stick to cortisol and dampen the stress response. The pups of negligent moms had the opposite outcome, and so became more sensitive to stress throughout life. These are considered epigenetic changes, meaning that they affect which genes are expressed without directly changing the genetic code. And these changes can be reversed if the moms are swapped. But there's a surprising result. The epigenetic changes caused by one single mother rat were passed down to many generations of rats after her. In other words, the results of these actions were inheritable. It's not all bad news though. There are many ways to reverse what cortisol does to your stressed brain. The most powerful weapons are exercise and meditation, which involves breathing deeply and being aware and focused on your surroundings. Both of these activities decrease your stress and increase the size of the hippocampus, thereby improving your memory. So don't feel defeated by the pressures of daily life. Get in control of your stress before it takes control of you.
And I found that was a TED Talk. I had never seen a TED Talk done that way, but it was really good. And you saw what he said there, exercise and meditation. The thing is that when we're under a tremendous amount of stress or we're depressed, lots of times that's the last thing we want to do is exercise. And that has been proven over and over and over again, that if we will just do something, if we will start to just get out, will you walk for 2 minutes? That's what I've said to many of my clients. Could I get you to walk for 2 minutes? Could we increase it to 4? Okay, could we go to 6? If we could just start. Typically, if we can just get started, we'll start to feel better. Same thing with meditation, and we'll talk more about that. So we're gonna, with these last few minutes, just kind of look at some ways that we can start to take care of ourselves with stress. And again, most of these you're gonna know, but are you doing it? And especially right now, recognizing our limits, being clear about what we can and can't do. You can't give what you don't have. We've got to learn to set some limits and some boundaries. And what can you say no to? And then what can you ask for help with? And we use the KISS, K-I-S-S, keep it super simple, keep it simple and sane. I'd forgotten about that one. And then keep it, what's the other one, Jamie?
Short and simple.
Keep it short and simple. I always forget that one. Keep it short and simple, keep it super simple, keep it simple and sane. Practice a state of relaxation regularly and manage your expectations. De-stress with meditation. There was a study that found that meditation can actually help preserve the physical structure of the brain. Following a healthy lifestyle by doing a diet like the Mediterranean diet, taking care of yourself and managing any health problems that you might have. And again, if you are a caregiver of somebody with dementia, we have to take care of ourselves to be able to take care of somebody else. More ways to relax, the deep abdominal breathing. That's one of those things that we can do anywhere. We talk about this a lot in our support groups that we have, and it comes up over and over and over again that this is one of the best tools that we can have in our tool belt, is to take those deep breaths, because what it does is it immediately puts oxygenated blood up to our brain so that we can respond instead of react in any situation. Respond instead of react. Using imagery, and if you've never used imagery before, that's a really neat thing. Guided imagery, you can Google that. A lot of these things you see listed here, we have some 30-minute programs called Stress Less with James L. West on our YouTube page that we did last year. We made some 30-minute programs on each of these. Guided imagery is where you are using your senses and you are going somewhere in your mind, basically, where you are using all of your senses and you are going to another place. It's very similar to meditation. Exercises there again, practicing gratitude, journaling, massage, reaching out, practicing spirituality. Making social connections. We found that out in the past year, how important it is to stay socially connected. And we found ways to do it, even if we have to do it on Zoom. So emotionally and spiritually well-being, this is something else we have figured out that we can do. You are what you think and what we surround ourselves with and what we watch and what we listen to. Changing negative thinking to change your brain. Here's a study that came out of Yale, found that individuals who hold negative beliefs about aging were more likely to have brain changes associated with Alzheimer's disease. We believe it is the stress generated by the negative beliefs about aging that can result in pathological brain changes. Negative beliefs about aging can be mitigated and positive beliefs can be reinforced so that adverse impact is not inevitable. And you've heard people that were 80, 85 years old that say, I feel like I'm 40, and they are acting like they're 40, and there's something to this. Spiritual activity, having a positive outlook and to be better able to manage negative thoughts. Having a mantra. If you have things in your office, around your computer, I'm looking at mine now. I have something on the back of my door. I have things right here in front of me. We just can't let that become part of the wall. Here's my new one. You're not going to be able to see it, but it says, not to spoil the ending, but everything is going to be okay. And having things where you actually read them throughout the day, not that they've just become part of the wall. We can really change the way that we look at the day. We can change our well-being with the things that we surround ourselves with, our reflection. And on the other hand, we can be the worst at putting the boxing gloves on and beating ourselves up. We've got to be careful at how we talk to ourselves and that we don't say things to ourselves that we wouldn't say to somebody else. Or if you're in healthcare, would you say that to your resident? Would you say that to a resident's family member? Why are you saying it to yourself? Be careful how you talk to yourself. Be careful how you think about yourself. Here's some of our resources that we used for this. Here's our information. Let me stop sharing and let me see if there's any questions or comments. We've got a couple of minutes left. You
Well,
will.
It popped in my head when you said that everything's going to be okay in the end. And then
Mhm.
so I've read before, it says if everything's not okay, it must not be the end.
Oh, that's great.
Yeah.
Yeah, here it is. Not to spoil the ending, but everything is going to be okay. I think I'm going to make this my background. I love it. All right. Well, thanks, everybody. We will
You'll
send
receive, sorry, you'll receive that follow-up email this afternoon with the copy of the slides and the link to the evaluation for CE credits.
All right. Thank you.
Thank y'all.
Have a good afternoon.